Blessings and peace, everyone, and welcome back to the Autoimmune Recovery Room, where autoimmune warriors unite. I hope everyone had a blessed and wonderful Thanksgiving. My name is Diana Carroll, and for those just joining, I want to start by saying this video is intended for informational purposes only, and it is not a substitute for medical advice, for diagnosis, for treatment, or pharmaceutical guidance. Always consult with your healthcare provider for any health concerns. This is Introduction Part 2 to Demystifying Autoimmune, the answers you need and the clarity you deserve. So last week, we explored what an autoimmune disease is. It is when the immune system designed to protect you from harmful invaders like bacteria, viruses, mistakenly attack your own tissues. Autoimmune disease can affect nearly any organ or tissue in the body and come with a wide range of symptoms, from pain and fatigue to more specific signs, depending on the disease. We also highlighted that there are over 100 known autoimmune diseases. And I just want to tell you, of that 100, there are 2 that I have that weren't even on there. So it's well known 100, that people say over 100. This week, we'll focus on a few more of these conditions, breaking them down into manageable, clear explanations. So the first one we'll highlight, actually it's twofold because it's psoriasis and psoriatic arthritis. So the body parts that are affected in psoriasis are skin and nails. Psoriatic arthritis are joints, tendons, and sometimes the spine. Symptoms in psoriasis are red, scaly patches of skin, itching, burning, nail changes. Psoriatic arthritis are joint pain, stiffness, swelling, fatigue. Risk factors for both is family history, infection, stress, obesity, and smoking. Complications: joint damage, cardiovascular disease, eye inflammation. Prevalence affects men and women equally, though severity varies. The next one is celiac disease, a disease problem that hurts your small intestines. It stops your body from taking in nutrients from food, an immune reaction to eating gluten, a protein found in wheat, barley, and rye. The body parts that are affected are small intestines, secondary effects on bones, nerves, skin, and liver. Symptoms: abdominal pain, diarrhea, bloating, malabsorption, weight loss, fatigue, skin rash. Dermatitis. Risk factors: family history, type 1 diabetes, Down syndrome, gluten consumption. Complications: malnutrition, osteoporosis, infertility, small intestinal cancer. The prevalence: slightly more in women. As you noticed from last week's, a lot of things that we talked about and diseases that are attacking women. Sjogren's syndrome, which is one that I have as well, is a systemic autoimmune disease that affects the entire body. While some people experience mild discomfort, others suffer debilitating symptoms that greatly impair their functioning. Half of the time, Sjogren's occurs alone, and the other half, it occurs in the presence of another autoimmune connective tissue disease, such as rheumatoid arthritis or lupus. Body parts that are affected are salivary glands, excuse me, these things, tear glands, joints, kidneys, liver, lungs, and nerves. Symptoms: dry eyes, dry mouth, joint pain, fatigue, swollen glands, skin rashes. Risk factors: female sex, age 40 plus, other autoimmune diseases, rheumatoid arthritis, and systemic lupus. Complications: dental decay, corneal damage, difficulty swallowing, lymphoma. Prevalence: 9 to 10 times more common in women. Crohn's disease, a chronic inflammation bowel disease that affects the lining of the digestive tract. A disease where parts of the digestive tract become inflamed. It most often involves the lower end of the small intestine and the beginning of the large intestine. Body parts: gastrointestinal tract, can affect anywhere from the mouth to the anus. Often, ileum, which is the last and longest section of your small intestine, which absorbs nutrients from digestive food for your body to use, like vitamins, minerals, carbs, fats, and protein, and the colon. Symptoms: abdominal pain, diarrhea, sometimes bloody, weight loss, fatigue, fever, mouth sores, malnutrition. Risk factor: family history, smoking, age range 15 to 35, urban living, diet. Complications: bowel obstruction, and an abnormal communication between gastrointestinal tract and the skin. Prevalence: affects men and women equally. The next one is ulcerative colitis, a chronic inflammation bowel disease that causes inflammation in the digestive tract. Ulcerative colitis is usually only in the innermost lining of the large intestine, your colon and rectum. Forms range from mild to severe. Having ulcerative colitis puts a patient at increased risk of developing colon cancer. Body parts affected: large intestines, colon, and your rectum. Symptoms: diarrhea with blood or pus, abdominal cramps, urgency to defecate, sorry about that, fatigue, and weight loss. Risk factors: ages 15 to 30 or 60 and over. Family history, stress, certain medications, your non-steroidal anti-inflammatory drugs, ibuprofen, etc., medicines that are widely used to relieve pain, reduce inflammation, and bring down a high temperature. Dangers of NSAIDs: the risk of bleeding and of cardiovascular events is considered higher in older people, of whom many take medicines known to interact with the medications. Complications: severe bleeding, toxic megacolon, colon cancer, dehydration. Prevalence: equal in men and women. Here's one I'm going to stumble over, okay, because it's a little dermatomyositis, a rare inflammatory disease marked by muscle weakness and skin. And I want to stop just for a moment to hear these names and how long they are. People hear from a doctor that I have this or I have that, and these are names you never even heard of, and you don't know if someone you know has it, or, so you don't get the kind of direction that you need to get, not only understanding, but people never heard of it. So how do they even give you empathy half the doctors can't even pronounce it correctly. So just to let you know that you're not alone here. Um, I've had 9 of them, okay, and didn't know where they came from or how they got here. No information whatsoever. But my whole goal is to help somebody understand you're not alone. You're not alone. That is the whole purpose of the Autoimmune Recovery Room, to let you know you're not alone. I understand what you might be going through. So the body parts that are affected by this are your skin, your skeletal muscles, sometimes your lungs. Symptoms are muscle weakness, shoulders, hips, skin, rash, red or purple on your face, chest or knuckles, fatigue, difficulty swallowing. Risk factors: female sex, age 5 to 15 or 40 to 60. Certain viral infections, complications: pulmonary fibrosis, muscle calcifications, cancer. Prevalence: twice as common in women. Scleroderma, chronic hardening and tightening of the skin, connective tissues, and joint pain. It is generally believed that people with localized scleroderma may live a healthy and long life with minor symptoms only, whereas people with systemic type may have a short span of life from 5 to 10 years. Body parts, tissues, systems affected: skin, blood vessels, esophagus, kidneys, your heart, your lungs. Symptoms: hardened, thickened skin, sensitivity in your fingers, joint pain, acid reflux. Risk factors: female sex, ages 30 to 50. Complications: pulmonary fibrosis, kidney crisis, heart failure, ulcers. Prevalence: 4 times more common in women. Ladies who might be listening, we need to get our act together. We need to figure out how to better help our bodies. As you can see from last week, I think maybe out of the 8 or so that I did, maybe only 2, not that you want men to be affected by it either, but we as women, and having the kind of control of home and things that we eat, things that we do, we've got to take better care of ourselves. So just to recap, autoimmune diseases are complex and can affect various parts of the body. Today we explored several conditions, and each condition has unique symptoms, risk factors, and complications, underscoring the importance of early diagnosis and proper management. And the whole thing is getting an early diagnosis, not ignoring things that are happening that might be different going on in your body. Don't ignore what is happening. Be alert as to what's happening in your body, okay? So the key takeaways, I hope: number 1, autoimmune diseases can impact any tissue or organ system in your body. Recognizing symptoms and risk factors is critical for early intervention. Many autoimmune diseases have overlapping symptoms such as fatigue and joint pain, but differ in their specific effects and risks. Women are disproportionately affected by autoimmune conditions. Self-care and lifestyle adjustments, along with medical guidance, play a crucial role in managing these conditions. Stay tuned for part 3, where we will continue to explore autoimmune diseases and empower you with knowledge and strategies for navigating these challenges. I thank you for watching again, and until next Friday, take care of yourselves, please. Take care of yourself. Take heed to what you're doing. on a daily basis. Take heed to any symptoms that you may feel. Don't ignore them, because you have played an important, crucial role in your family, in your life. So remember that bruised wings can still fly. Peace and blessings until next week. God bless.